Hello guys. Yes, one more very important question in pharmacology, that is explain the pharmacodynamic drug interaction. Before going to this, you have to understand some of the basic terms here. Now, what's that? First, you understand what is this drug interactions. See, the drug interaction is a situation in which a substance affects the activity of a drug. Okay, means here the substance what it will do, it will affect the activity of the drug, and the effects are increased or decreased, or they produce the same new effect that is not produced on its own. Understand the concept here. See what happens, drug interaction means you know that it is a substance which affects the activity. Now affection of the activity, either it will increase the natural drug or it will decrease the natural drug. Okay, now what is that natural drug, we will discuss that later. Now basic classification of the drug interactions, two classification. One is of a pharmacokinetic drug interaction, next one is of a pharmacodynamic drug interaction. If you know the terms or meaning of this pharmacokinetic and pharmacodynamic, then your concept is clear here. First understand pharmacokinetic means, just in a single word I will tell you. Kinetic means here movement, absorption, okay, biotransformation, these all comes under the kinetics. Now pharmacodynamic means drug interactions, activity of the drug, then site of action, mechanism, pharmacology, these comes under the pharmacodynamic of the drug. Clear? Now here in this video we will study about the pharmacodynamic. Inshallah in next videos we will discuss about the pharmacokinetic. Both they have asked in the examination. Then pharmacodynamic, see these interactions are those in which the activity of the object drug at its site of action is altered by the precipitant. Understand the concept here. See here what happens, these drugs what they will do, they will either the interactions in which the activity of the object drug means here. See for an example, you have take here acetylcholine is one drug. Okay, then one more drug, precipitant drug. Now precipitant drug is a noradrenaline, is a precipitant drug. Okay, two drug. Now what happens here, the activity of the object drug which I have told, the activity of the object drug means here acetylcholine, it is the object drug, and its site of action is altered, means this acetylcholine's site of action, it is altered by the noradrenaline. Okay, afterwards I will explain you by giving the example. Okay, you just understand this one. Pharmacodynamic means what, just here the interactions where the interactions, drug interactions in which the activity of the object drug and the site of action is altered. Then such interaction here means those interactions, they are classified as two types in pharmacodynamic drug interaction. Two classification, basic classification. One is of a direct and indirect classification. Now you know that direct means here just the interaction is, they are direct one, means drugs having similar or opposing pharmacological effects are used concurrently, means they have either they will produce a similar action or opposing action, means antagonistic, either agonist or antagonistic, these action may be produced by the direct pharmacodynamic interaction. Here first let's study what is this antagonism. The interaction of the drugs have opposing action. Now I will give you example. See acetylcholine, they will decreases and noradrenaline increases, have opposing effects on heart rate. Means what is this, means acetylcholine and noradrenaline, these are the two drugs I have explained you later only, where in the pharmacodynamic. Acetylcholine, what it will do, it will decrease the heart rate. In the same way noradrenaline, it will increases the heart rate. See what happens if you give noradrenaline, means yes actually obviously it will increase the heart rate. If the patient's heart rate is low, means we are giving noradrenaline, okay, to increase the heart rate. If suddenly anyone gives him acetylcholine, means what happens, the drug interaction takes place, okay, and suddenly there will be decrease in the heart rate. Why? Because acetylcholine work is to decrease in the heart rate. Okay, the opposite use of the noradrenaline. This is the simple antagonism, means opposite action. Addition means the next one is addition. The interaction drug have similar actions and the resultant effect is the sum of the individual drug responses. Here, now for an example, control nervous system depressants like sedative and hypnotics. What they will do if you take this sedative and hypnotics, they act as an similar actions. Due to the similar actions, what they will do, they will suppress the CNS. Like you are giving some of the sedatives and hypnotics, carbazepine, phenytoin. These are two drugs. If you given means addition action. Clear? 1 plus 1, 2. This type I am telling. The next one is a synergism. It is the enhancement of action of one drug by another. Means increasing the activity of one drug by another drug. Example, alcohol increases analgesic activity of aspirin. You know that aspirin, it is an analgesic drug which is used to treat the minor pains or acute pain. To increase the activity of that analgesic, alcohols are given. This is one, a synergism. Yes, these are the three concurrent basic under classifications under the direct pharmacodynamic: antagonism, synergism, and the addition. Next, indirect pharmacodynamic interactions. The indirect pharmacodynamic interactions is a slightly different. In that means in this indirect pharmacodynamic interaction, the drug doesn't affect the pharmacodynamic response. Here, the drug directly, it won't affect the pharmacodynamic interactions or response, but the drug will affect the precursor. Then it will affect automatically the pharmacodynamic interactions occurs. Means pharmacodynamic response will be shown. For an example, see salicylates. Salicylates, what they will do, basic salicylates I am telling, like some of the aspirin you take, it is a salicylate. Now these salicylate, what it will do, these will slightly decreases the activity of the platelets. Now you know that platelets helps to break down the blood cells. Means they act as an for the coagulation. Okay, blood thinners. Salicylates act as an blood thinners. To thin the blood, we are using some of the salicylates, like which one? Like aspirin. If suddenly you give warfarin to that, means warfarin, it is a anticoagulant. To prevent the coagulation, we are giving that one. Which one? Warfarin. If you give suddenly warfarin, means what happens? There will be chance of clotting. Why? Aspirin, salicylates, what they will do, they will degrade the activity of the platelets. You know that platelets help act as an coagulation, means they help for the coagulation, to coagulate, to make the blood clump. We are means platelets are mashhoor, means they are very popularly known for the clot. Now salicylate decreases the activity of the platelets. Clear? Are you getting? No? Now if you give warfarin again to that patient, means what that it will do, the warfarin act as an anticoagulant, again it will thins the blood and there will be chances of bleeding. Yes, this is the indirect action of, directly it won't hit, but it goes after a few days or few months, what it will do, it will affects the warfarin, means it will affect the platelets. Then there will be chance of the thinning, very thin of the blood, and that blood may be chance to flow out of the vessels and cause the excessive bleeding, which is very dangerous. Yes, these are the very important pharmacodynamic interactions, drug interactions. Inshallah, in next class we will discuss about the pharmacokinetic drug interactions. Thank you.